Psychiatrists just want to drug you and take your money. They don't even listen. They don't really care what's going on with you. They just want to give you meds until you stop complaining. These are all really valid expressions of emotion and response to psychiatric care that get directed at me all the time on my channel. So I'd like to talk about them from my perspective as a psychiatrist. And I'd like to be clear about one thing first, which is that oftentimes as psychiatrists, our professional role is to help people deal with overwhelming emotion. The fact that the emotion is overwhelming means that sometimes it's not going to come out in the most friendly way. I'm sure some people disagree with me, but I have found in my practice that taking a non-defensive approach and trying to get at the underlying emotional experience of the person directing that kind of criticism at me is a much more productive way to build bridges than getting up in arms and defensive about it. Now, this video is going to be a little bit all over the place, but let's start with the financial incentive piece. In fact, a psychiatrist doesn't get paid any more money for putting you on more drugs. At least I certainly don't. I can see a patient who is on 3 or 4 psychiatric medications, or a patient who's on 1 psychiatric medication, or a patient who doesn't take any psychiatric medication, and the billing is ultimately going to be about the same. Though at times, psychiatrists will get reimbursed differently depending on the complexity of the visit, but that's more to do with how many different problems are addressed during the visit, the difficulty of those problems, and less to do with what you prescribe in response to treat those problems. Second, let's talk about the idea that we don't care. Now, I'm still in my fellowship training, and because of my particular interests, I'll be doing 2 fellowships, making the total length of my training from college to the anticipated conclusion of all fellowship training 16 to 17 years. To put that into perspective, I taught Taekwondo to an 8-year-old who has gone on to finish high school, finish college, and start a successful career in chemical engineering, all in the time that I have been in education and training. I do this because I'm intensely passionate about this work. It really matters to me. Now, sometimes I'm nearly useless in my ability to effect change in the ways that I want to for the patients I work with, and I think that's true for all of us, unfortunately. But that doesn't come from a place of not caring, at least for me, but you'll have to take my word for it because I know that sometimes it doesn't feel like it. Which brings us to the third topic of this video, which is why oftentimes it does feel like it. On the one hand, the American healthcare system, which is set up for short, disease-focused visits, is not always the most validating thing, especially when you're trying to get an entire lifetime trajectory of development understood. It can feel like you're being reduced down to symptoms and diagnoses in the DSM, which is really frustrating to people. As psychiatrists, we are trained to present our formulation of things in a better way, ideally, but we're not perfect and it doesn't always make the mark. On the other side of that coin, a lot of the time we're dealing with intense emotional dysregulation. We're dealing with entrenched maladaptive patterns of communication and relating to oneself and the world around a person. These are processes, and it doesn't make someone good or bad because they have or don't have struggles with these things, just like any other medical issue. But sometimes even when the care is ideal, and oftentimes it's not due to many variables that we've been discussing, it doesn't feel like it, and that's part of the problem being addressed. Long story short, there are a whole number of variables on the clinician and the patient side that make it really hard to build that sense of healing and connection. As psychiatrists, it's our job to hold that challenge and work on it every single day with every single patient. And it's my sincere hope that if ever you need psychiatric care, you find a psychiatrist who's able to build that space with you. As always, I'm interested in learning from you. If you've been a patient or if you're a clinician, how do you bridge the gap of communication that often leads to the sort of feedback that I offered at the beginning of this video as an example? I look forward to learning from you in the comments.